Working in aged care is a career that requires compassion, patience, and dedication. Unlike many other roles in the healthcare sector, aged care involves not only providing medical support but also offering emotional comfort, companionship, and dignity to elderly individuals. Employers in this field look for candidates who can balance practical caregiving skills with empathy, communication, and an understanding of the unique challenges faced by older adults. For this reason, interviews for aged care positions often test both professional expertise and personal qualities. Preparing for an aged care interview is essential if you want to stand out as a strong candidate. Beyond knowing how to assist with daily living tasks, employers want to see that you genuinely care for the elderly and can handle difficult situations with sensitivity. In addition to technical questions about patient care, you'll also be asked behavioral questions that test your problem-solving skills, emotional resilience, and teamwork. In this guide, we'll go through common aged care interview questions, with sample answers and tips to help you feel confident and ready. Question 1. Why do you want to work in aged care? Answer. I have always been drawn to caring roles, and I find it deeply rewarding to support elderly people in living their lives with dignity and comfort. Aged care is about more than just meeting physical needs. It's about companionship, listening, and ensuring residents feel respected. I believe my patience and empathy make me well suited to this role. Tip. Show genuine passion for the role. Employers want to see that you are motivated by more than just a paycheck. Question 2. How would you handle a resident who refuses care? Answer. I would first listen to their concerns and try to understand why they are refusing. Sometimes it's fear, discomfort, or a lack of trust. I would reassure them, explain the importance of the care being offered, and give them choices to help them feel in control. If the refusal persists, I would document the situation and inform my supervisor for further guidance. Tip. Stress patience, respect, and communication. Never say you would force someone into care. Question 3. What experience do you have working with elderly individuals? Answer. I have worked in a residential aged care facility where I assisted residents with daily tasks like bathing, feeding, and mobility. I also built relationships with them by engaging in conversations and activities. I learned that caring for the elderly isn't just physical, it's emotional support too. Tip. If you don't have formal experience, highlight volunteer work, family caregiving, or transferable skills. Question 4. How do you handle stressful or emotional situations? Answer. In aged care, stressful situations are common, such as when a resident becomes ill or uncooperative. I handle stress by staying calm, focusing on the immediate need, and relying on teamwork. Afterward, I reflect on the situation and talk to colleagues for support if needed. Maintaining emotional balance helps me provide the best care possible. Tip. Employers want resilience. Show that you can stay composed and professional under pressure. Question 5. How would you care for a resident with dementia? Answer. Caring for someone with dementia requires patience and understanding. I would use simple communication, maintain routines to avoid confusion, and provide reassurance if they become anxious. I would also ensure their safety by monitoring them closely while encouraging independence as much as possible. Tip. Demonstrate empathy and awareness of dementia-specific needs. Question 6. How do you maintain the dignity and privacy of residents? Answer. I always knock before entering a resident's room, explain what I'm about to do before providing care, and respect their preferences. For example, when assisting with bathing or dressing, I keep them covered as much as possible. Small actions make a big difference in preserving dignity. Tip. Dignity and respect are non-negotiables in aged care, make this clear. Question 7. How would you deal with a conflict with a coworker? Answer. I would address the issue calmly and professionally by discussing it directly with my coworker in private. If we couldn't resolve it, I would involve a supervisor. In aged care, teamwork is crucial, so I always focus on cooperation and keeping residents' well-being as the top priority. Tip: show maturity and commitment to teamwork. Avoid mentioning workplace gossip or negativity. Question 8. How do you manage multiple residents' needs at once? Answer: I prioritize tasks based on urgency. For example, if one resident needs immediate medical assistance while another requires routine help, I attend to the emergency first while ensuring others are safe and comfortable. Good time management and teamwork allow me to meet everyone's needs effectively. Tip: highlight organizational skills and the ability to multitask under pressure. Question 9. What would you do if you noticed signs of abuse or neglect? Answer: I would take it very seriously and follow the organization's safeguarding policy immediately. That means documenting what I observed, reporting it to my supervisor, and ensuring the resident is safe. Protecting residents from harm is a core responsibility of aged care workers. Tip: employers want to see integrity and a zero-tolerance attitude toward abuse. Question 10. How do you build relationships with residents? Answer: I build relationships by listening, showing interest in their stories, and treating them with respect. For example, I ask about their past experiences and hobbies, then incorporate those into daily activities. This creates trust and makes residents feel valued. Tip: show that you go beyond physical care to provide emotional support and companionship. Question 11. What do you find most challenging about working in aged care? Answer: one of the most challenging aspects is dealing with loss, as residents may pass away. While it is emotionally difficult, I focus on providing the best possible care and comfort to residents while they are with us. I also rely on team support to cope with these situations. Tip: acknowledge challenges honestly but frame your answer positively, showing resilience. Question 12. How do you handle family members who are worried or upset? Answer: I listen to their concerns, acknowledge their feelings, and provide clear updates about their loved one's care. If their concerns require further input, I involve a supervisor or healthcare professional. Families want reassurance, so open and empathetic communication is key. Tip: emphasize empathy, patience, and professionalism when dealing with families. Question 13. Can you describe how you work in a team setting? Answer: I believe teamwork is essential in aged care. I communicate openly with colleagues, share responsibilities, and offer help when others are busy. For example, if a coworker is assisting one resident, I step in to cover others so that everyone's needs are met. Tip: show that you're cooperative and reliable. Team spirit is highly valued. Question 14. Where do you see yourself in this field in the future? Answer: I see myself continuing to grow in aged care, possibly taking on more responsibility as a senior care worker or trainer. I want to contribute to improving care standards and mentoring new staff so that elderly residents receive the best support possible. Tip: show commitment to the field rather than treating it as a temporary job. Closing thoughts. An aged care interview is designed to test more than just your ability to perform basic caregiving tasks. It evaluates your compassion, patience, and commitment to the dignity of elderly residents. By preparing answers that reflect both your technical skills and emotional intelligence, you can stand out as a well-rounded candidate. Always remember to show empathy, emphasize teamwork, and highlight your ability to stay calm under pressure. If you practice thoroughly and answer with sincerity, you will demonstrate that you're not just qualified for the role, you're the right person to provide comfort, care, and dignity to elderly individuals who need it most.